Many parents acknowledge the need to vaccinate their children against HPV eventually, but question the need to vaccinate young pre-adolescents before the onset of sexual activity. In these cases, it is helpful to explain the rationale for recommending routine vaccination at age 11 or 12. For any vaccine to be effective, whether it is chickenpox, measles, or HPV, the vaccine needs to be administered well before any exposure to the real disease. It is therefore most effective to vaccinate against HPV at age 11 or 12, specifically because most children have not been sexually active at this age. Additionally, there is now evidence that the efficacy of the vaccine is better when administered at age 14 or younger rather than 15 years or older, because the immune system responds to the vaccine more robustly during this younger age range. Therefore, if a family does intend to vaccinate, the child would get the most immunological benefit from the vaccine if it were administered at a younger age. Parents can also be reassured that studies have shown that the HPV vaccination does not result in adolescents having sex at younger ages. In this scenario, when a parent wonders if his 11-year-old is too young for the vaccine, the pediatrician clearly outlines the rationale for vaccinating at this age.
Everything looks great. Emily's physical was perfectly normal. So today you're just due for a couple of routine immunizations. The immunizations that Emily's due for today are the TDAP, the HPV, and the meningitis vaccine.
Isn't the HPV for when she's a little older?
Actually, all of these immunizations are important for her right now at this age. Specifically, the HPV vaccine is a vaccine that's to prevent cervical cancer from a virus that is transmitted as an STD, which is a sexually transmitted disease. So we're hoping that Emily's not going to really be at risk for that kind of infection until she's much older. But if she gets these immunizations at this age, then she'll have good antibody protection that will help her for the rest of her life.
But can't this wait? She's only 11.
So the studies have shown that kids who get their HPV immunization before they're 14 years old actually make better antibody protection. So it's really important to protect kids against this virus before they ever get exposed to it. It's the same as with many of our other immunizations, like the measles, the chickenpox, the hepatitis vaccines. Those ones, you need to get the vaccine before you're exposed for them to actually protect you.
The pediatrician explained that HPV is a sexually transmitted virus. It might also have been helpful to emphasize that unlike other sexually transmitted diseases, like chlamydia or gonorrhea, HPV affects the vast majority of people who will ever have sex in their lifetimes. It is important for us as providers to remind ourselves that we cannot make any assumptions about when our pediatric patients are going to start having sex. Across the United States, by their 13th birthday, 2.2% of girls, 5.3% of boys, and 3.7% of children overall have already had sex at least once, and the vast majority of this sexual activity was consensual. So as providers, we need to remember that HPV vaccination is recommended at age 11 for a reason, and to avoid deviating from this schedule based on potentially incorrect assumptions about a child's risk. Providers can support completion of the full HPV series by telling families about the dosing schedule ahead of time. An office system for reminders and recalls to complete vaccination, whether by text, telephone, or email, can be enormously helpful for families. For new patients who have forgotten to bring their vaccine records, providers can access the county immunization registry either directly or by linking their electronic health record to the registry. Particularly when seeing adolescents, it is important to include the patient as well as the parent in the discussion about vaccination. Adolescents often have their own questions, concerns, curiosities, and opinions about vaccination, which they should have the opportunity to voice. It is not uncommon for adolescents to want the HPV vaccine, even if their parents have hesitations. Their participation in the discussion may in fact encourage their parents to think differently about the issue.